Hello, everyone, and thank you for tuning in to the Indiana State Police Roadshow. I am your host, Sergeant John PERRINE, State Police Public Information Office. The Roadshow is brought to you by the Indiana State Police Alliance and Cops for Kids, a subsidiary of the State Police Alliance. We have a great show for you today, and it's a problem, an epidemic that spans nearly every community in the country. And we've brought in some guests to talk about opioids, opioid addiction, and more importantly, the response to the aftermath of an opioid overdose or somebody who needs some help. So my guests are Monica GREER. Monica is the director of the Hamilton County Council on Alcohol and Drugs, and that's in Hamilton County, Indiana. And we also have Sergeant Billy Adams from the WESTFIELD Police Department that I know from personal interaction is very much involved in everything to do with the Council on Alcohol and Drugs. So thank you both for being here.
Thank you.
So this is a problem that a lot of communities face, and that's opioid addiction, almost specifically heroin, but there's also prescription pills and all of that things as well that affect a lot of people and leaves a lot of people scratching their heads like, well, what do we do? And so you guys, as a conductive group, have come up with an idea, and it says, let's see if we can find a resolution and offer some help. So tell us what happens in the aftermath anytime you guys get word of an overdose or a substantial addiction.
Okay. Yeah, we started a coalition last October, and our goal is to reduce the overdose deaths in the county. And we built a coalition of about 30 people or so and got some federal and state funding to help with that. So what we're going to do is when a patient survives the overdose within 48 to 72 hours upon release from the hospital, we have a team of law enforcement, fire, and peer recovery specialists that are the team that will go out and hopefully make a home visit. This is all going to be voluntary, obviously not mandated, but hopefully get them the treatment recovery resources that they could utilize.
And this isn't just you guys knocking on the door and handing them some flyers. Tell them, what does this look? You guys are going to coach them through this essentially.
Yeah. Our fighters have been through peer recovery coaching. Law enforcement has extensive training on crisis intervention tactics, and so we're there to help them. We're not there to punish them. We want to get them the resources that they need. Also, their family members. A lot of the family members or loved ones that are living with them are in a crisis as well. So getting them the resources that they would need to help deal with the addiction as well. We're going to hold their hand, take them to treatment if necessary. We've got peer recovery specialists that will take them to meetings, recovery meetings. If they don't have any idea of what it is, they will help them get connected with that just to help them feel comfortable. And the peer recovery specialist is in recovery herself, so she can really relate to them and help them.
And that's real important. And so, Billy, I'm sure when you began your career and back when 16 years ago, if I responded to a drug overdose, most of the time it was somebody trying to commit suicide by taking a bunch of pills or something like that. Sure. But it's so common now to go to these opioid overdoses. What do you tell the family members of somebody that's just scratching their head, just at their wits' end saying, I don't know what to do? What advice can you give them?
Like you said, 16 years ago, this was vastly different for law enforcement.
And that shows the evolution of what we're seeing.
Right. Personally, that's why I've kind of gained such an interest in this particular program, because 16 years ago, law enforcement's approach to this was enforcement. It was a drug problem. We arrest, we re-arrest, and we tried to solve the problem through enforcement. And it's taken that amount of time for law enforcement to kind of get on board with the prevention aspect of it, the treatment aspect of it. Mm-hmm. Not something typically that law enforcement would have been viewed as being a part of a program like this. Yeah. So it's very interesting that now the families, the patients, they can see that we're not there to take them to jail, that we're there to help them, and that the police can be such a resource to them and a helping hand.
Yeah, even with legal consequences that are probably always going to be there.
Sure.
You want people more to see the consequence of the destruction of families than losing your job and your career and all of these things that you lose. And we've all seen it firsthand, that the incredible power that this addiction has for people just to give up everything.
Absolutely.
And it doesn't just affect one class or one group of people or one community. It's widespread. And if you're not seeing it, I can assure you it's in your community. And so how do people help? Where do you direct somebody that says, hey, I know my neighbor is having trouble. How can I get them help? What advice?
We've developed a lot of resources. We've got a resource guide. We're also going to be doing some community canvassing, so knocking on doors, just passing out information. And like you said, it's not just the addiction itself that's the problem, so we're going to have resources on how to sign up for insurance, or if they don't have their ID, how to help them get a picture ID. So yeah, it's just, I think, word of mouth, and once we get going, we've got a full-time coordinator, so someone can call and get more information. Our focus right now is on the overdose.
Okay.
So that's the program that we have funded for now, but we're definitely going to provide resources to any community member that needs it.
And do you have any statistics? And I know you're specifically in Hamilton County, but do you have any statistics about how many overdoses per year we're seeing?
In Hamilton County, we had 37 overdoses in 2018. We know that number is lower than what the actual overdoses are. A lot of times at the time of death, they don't say heroin overdose or opioid
comes
overdose.
In later in the report.
Yeah, or it's heart attack or heart failure, something like that. So talking to the coroner, we know that it's even higher than that. So it's still there. Still a need.
And Billy, this is something that we're seeing, car crashes and people. It's not drunk driving car crashes anymore. It's 1:30 in the afternoon and somebody's impaired on opioids driving. And what are you seeing on that?
Oh, absolutely. I believe 2018 for the state of Indiana was the first year ever that drugged driving overtook alcohol related driving on deaths caused by accidents.
Yeah, and that's incredible. And it's scary because sometimes people will take these drugs and maybe the high isn't as high for them as it used to be. So they think, oh, I'm okay, I can drive. I've been doing this long enough. And then they crash and they hurt or kill somebody, and the consequences become tenfold in that instant. So there's a lot of resources out there throughout the county, but this model that you're doing, is this a proven model or is this just something you guys are trying?
Yes, it's been proven to be effective. We had Coleraine Township out of Ohio come over and train us, and they had been doing this type of work for at least 3 years, closer to 4 now. So we use their model. This isn't a new type of model. It's all over the United States. There's other teams. We feel like we're pretty unique. In Hamilton County, though, our prosecutor is on board, and like Billy can talk further about the law enforcement side, but it's nice to have the cooperation and collaboration from all of the community on it.
Yeah, because it seems like for a while there, somebody would overdose on opioids, they'd go to the hospital, they'd come back out, and there would be no consequence or no repercussions for their actions. And then law enforcement steps in and says, hey, to tell you what, we're just going to start putting people in jail. Well, that's not proven to be working either, because they're coming out of jail and going right back into it. So it's about not just giving them consequence, but giving them a future. So what's the law enforcement involvement in this program that she's doing?
Well, there's 3 team members, as she said. So you have the paramedic or the EMT that's going to be on scene to help them and talk to them about their health. You have the peer recovery specialist who is on their level, who can talk to them and truly say, I understand what you're going through. And then the law enforcement person, our primary duty there on the team is security of the team itself. You're going into the homes of the user, and so security of the team is our primary.
Sure.
But as law enforcement, we also have some very specific authority that the other team members do not have. So when we go into the house, if we see paraphernalia, we see something illegal, we have the authority to seize that.
Okay.
And then with working with the prosecutor's office, because this is a very voluntary program to get treatment, we can kind of use that and say, hey, prosecutor, I seize this. We're not there to arrest them. We're not there to charge them. However, we can maybe use this, encourage them stronger to be
So
involved
other
in
than the
program.
Westfield Police Department, what other police agencies are involved in this in Hamilton County?
The program started off, we got the grants approved for Westfield and Carmel.
Okay.
And we're in the process. Noblesville and Fishers have already, their police chiefs are on board. their fire departments are on board.
Okay. So if the grants only cover those cities, is the response only for those cities, or is it countywide?
Right now, it's Carmel and Westfield.
Okay.
We got Division Mental Health and Addiction grants for those two communities, but we also got a federal grant to serve the entire county.
Yep.
So we wanted to pilot in Carmel and Westfield, kind of get our feet wet and know what to do and what not to do, and then we'll move into the other communities.
Now, if you're listening to this show and you're thinking, well, that's not really fair, I can assure you one thing, that if you know somebody that's struggling with addiction, somebody's had an overdose, and you don't know where to reach out, Monica will answer her phone.
Yes.
And she will point you in the right direction, or Billy, or anybody.
Yeah.
So just because you don't live in those communities or it doesn't happen in those communities, don't think that this can't have an effect on you.
Yes.
And so it's important, those resources, because a lot of times friends, family members, they don't want to see their person go to jail, but they don't know where to go. And so where is somebody, if I'm looking on the internet, how do I get help for my brother who's hooked on heroin? What are some resources for people?
Yeah, definitely. They can obviously call my office and I can give them resources. But we have the Suburban North Club in Muncie, in Noblesville, that we offer a lot of AA, NA, Al-Anon meetings, so we can connect with recovery community. We have, like you said, police departments have resources. Like I said, we've got a coalition of 30 professionals within the community that can help as well.
And I've interacted with people recovering from addiction or currently addicted, and one of the biggest things is they say, I can't afford to get help. I can't afford to go. And my thought is, well, if you can afford the drugs, you can afford the help. But I do understand that. So are there free resources out there for people?
Yeah, I'm not sure if free is the right word, but we've come a long way with treatment, and the state of Indiana has a great program for people that don't have the money or insurance. The HIP program, a lot of the treatment agencies take that insurance now, so a lot of based on your income type of program, but we will help the patients find what will fit for them. We have collaborated with Aspire in Noblesville and Westfield. They have a health clinic, so if somebody needs medical assistant treatment, for instance, Vivitrol, they can help them with that. So I feel like if somebody wants help, they're going to get it. Yeah. We're going to figure out a way.
Yeah. And that's the thing. The first step is reaching out, because this is something we'd like to see completely go away. And I know you've experienced this, Billy, but nothing's more heartbreaking than seeing somebody in that overdose state requiring Narcan, and you're there working on them as a law enforcement officer. You're there first, you're giving them the Narcan, whatever, and you look up and their children are watching, or their mother's watching, or their family member. It just rips your heart out. Well,
it rips your heart out in the moment. It rips your heart out when you're the officer telling the 4 or 5-year-old that daddy's not coming back home.
Yeah.
You're knocking on a door and telling somebody, a mom and a dad, that their 18-year-old son was found. It's one of the worst things you'll ever have to do in this job.
Absolutely. And you bring up a good point is, it's a scary thing. And my understanding of addiction to this point is it hits your system one time and there's a little bit of addiction that almost starts.
Opiate specific.
Yeah.
If you get down to the toxicology, pharmacology of how the opiate works, it is the most addicting drug out there.
Now, what people that don't know a lot about it need to understand is there are legal opioids that are prescribed to people for pain medication, and sometimes that's where the addiction starts.
It is, absolutely. And that's really, if you look into the opiate epidemic that we're in, that is really how mainstream America got hooked. I mean, heroin used to be considered a dirty drug, a street drug.
Yeah.
And that's not the case now because of the pharmaceutical problem that we got into, and now that we've tried to lock that down.
Yeah, so it seems like maybe it started with that prescription. The doctor takes away the prescription. You can't get it anymore. And heroin, so you're looking for other things.
Heroin is stronger,
and heroin's there, and it's cheaper, and it's easier to get. So really, really unfortunate. But again, this is a problem in every community, not just in Hamilton County where you guys are from. But thank you for coming on and sharing this message. We want people to know that there is help out there. There are resources out there. Monica GREER at the Hamilton County Council on Alcohol and Drugs. You can look her up on the internet. She will help you no matter where you are. She will get you a resource. So You have been listening to the Indiana State Police Roadshow. Thank you for tuning in.